Good day everyone, I am Naisa Faith Pelocente, a Bachelor of Science in Nursing student at Jose Rizal Memorial State University. And for today, I will be performing a return demonstration on the assessment of the neurologic, musculoskeletal, and peripheral vascular systems. But before we proceed, we have to of course perform hand hygiene and put on our PPE if necessary. So, good day ma'am, I am Naisa Faith Pelocente and I will be your student nurse for today. Kindly please tell me your complete name and your birthday.
Kami S. Jola, October 18, 2001.
Okay, so that is the first thing that we need to do. We have to identify our patient to be sure that the right patient receives the intervention and helps prevent errors. And if there's any curtains or doors in the room, we have to close them as well to provide privacy to our patient. Yeah. So how do you want me to call you po?
Miss Rika.
So Ms. Rika, I am here to perform an assessment on your neurologic, musculoskeletal, and peripheral vascular systems. And we do this to be sure that everything is normal, and if there's any other abnormalities, we have to take note of them to prevent further complications. So do you have any questions before we proceed?
None.
Okay, but if you have, you can just ask me throughout the assessment. So I will now observe the overall hygiene and the physical appearance of my patient. Can I please see your hands, your nails? Okay, good. So assessing the overall hygiene and physical appearance of our patient can provide clues about the mental state and the comfort level of our patient. Next, I will be assessing the mental status of my patient. In doing that, we need to evaluate the patient's orientation to person, place, and time. So, do you know me po ba?
Yes, ma'am. You are my student nurse, Miss Naisa Faith Pelocente.
And do you know where you are right now?
Yes, I am in your clinic.
And the time?
It's 8:58 in the morning.
Okay. Next, I will be assessing the consciousness of my patient. So, are you aware that you are in my clinic?
Yes, ma'am.
Okay, good. Now, I will be assessing the memory of my patient. So, can you recall po ba what's your ulam po yesterday? Breakfast?
Hot dog.
Okay, good. Next, I will be assessing the abstract reasoning of my patient. So, can you please explain the proverb, the early bird catches the worm?
Pwede ba siya, ma'am?
Yes, pwede po.
Ug musayo ka, dako ang chance o advantage nimo na ma-fulfill imong goal.
Okay, good. If intellectual ability is impaired, the patient usually gives a literal interpretation or repeats the phrase. Next, I will going to evaluate the patient's ability to understand written and spoken word. This helps assess for aphasia. So, do you understand this written word, ma'am?
Yes, ma'am. Nurse.
Okay, that's good. We will now proceed in testing the cranial nerve function of my patient. So, can you please close your eyes? Close your one nostril. Okay, good. Can you tell me what's the smell?
It's coffee.
Okay, cover the other side of your nostril. Okay, so can you identify this smell?
It's alcohol.
Okay, good. Next, I will be testing the visual acuity and pupillary construction of my patient. So, focus on this object as I bring it closer to your nose. Okay, that's good. And I will be going to test your 6 cardinal position of gaze. Can you just please follow my fingers? Okay. Okay, that's good. Now we will be asking our patient to smile, frown, to wrinkle their forehead, and to puff out their cheeks. So can you please smile for me? Frown, or wrinkle your forehead, and puff out your cheeks. Okay, that's good. Now I will test the hearing of my patient. Can you please face the wall? As I will whisper some words. Nurse.
Nurse.
Say it again.
Nurse.
Okay, good. Next, we will be testing the gag reflex by touching the posterior pharynx with a tongue depressor. Explain to the patient that this may be uncomfortable. An intact gag reflex indicates normal functioning of CN9 and X, which is the glossopharyngeal and vagus. I will put my hands on your shoulder, and can you kindly shrug again? Okay, good. I will going to put my hands on your cheek. Is it okay with you? You can kindly push against it. Okay, good. Then the other, kindly push against it. Okay, good. Now I will be inspecting the ability of my patient to move her neck. So can you please touch your chest using your chin? Okay, good. And touch your shoulders using your chin. The other. And your ear to the corresponding shoulders. Okay. Can you tip your head back as far as possible? Okay, good. Now I will be inspecting the upper extremities of my patient. I will be going to inspect her skin for any color, presence of lesions, rashes, and muscle mass. I will also going to palpate for texture, temperature, and presence of masses. So, okay. Okay, so there's no signs of any skin lesions. So now we're going to ask my patient to extend her hand and her arms and to rapidly turn her palms up and down. So please extend your arms and turn your palms up and down fast. Okay, so good. Can you flex your upper arm as you resist my force? Okay, go. Good? Okay, good, nice. I will now going to inspect and palpate your hands, fingers, wrist, and your elbow joints. Your wrist. Okay, your other hand, please. Your elbows. Okay, good. There's no signs of any abnormalities. Next, we will palpate the radial and brachial pulses of the patient. Pulse palpation evaluates the peripheral vascular status of the upper extremities. I will now ask my patient to squeeze the two fingers of my hand to test the muscle strength of the hands of my patient. So can you please squeeze this harder? Okay, good. So the muscle strength of the hands of my patient is okay. Now I will ask my patient to close her eyes, and using my fingertip, I will write a digit on her palm. So can you please close your eyes and give me your hands? Can you guess what number I wrote?
9.
Okay, the other.
2.
Okay, good. This test evaluates tactile discrimination, specifically graphesthesia. Now I will going to ask my patient to close her eyes again and make her guess the object that I will put in her hands, on her hands. Okay, close your eyes. Give me your hands. Can you guess this object? Feel it.
Ball pen.
Okay. Your other hand, please. This one.
Alcohol.
So this test evaluates tactile discrimination, specifically stereognosis. So I will now assess my patient to a supine position, and I will going to examine the lower extremities. I will inspect the legs and feet for color, lesions, varicosities, hair growth, nail growth, edema, and muscle mass. So please. We will need a bath blanket to cover any other exposed area, other than the one being assessed. I will now going to inspect the feet for any colors or varicosities. So there is no signs of any varicosities or any excessive hair growth and nail growth, and no signs of any skin lesions as well, and the skin color of my patient is also normal. I will now inspect for any signs of edema. So if you press, we need to put pressure, and if it quickly returns to normal, then there is no signs of edema. But if it remains indented, then there is a presence of edema. But as I inspect the skin of my patient, it is normal. There's no signs of edema. Now I will going to palpate for skin temperature of the lower extremities of my patient. Okay, so the patient's temperature is okay. It's normal. Now I will be asking my patient to perform the straight leg test with one leg at a time. So can you please raise your right leg for me? Okay. Good. The other, please. Okay, good. So this test checks the vertebral disc problems. So Ms. Rita, can you please move your leg laterally? One leg laterally. Okay, good. So this maneuver assesses the ROM and provides information about joint problems. And as I observe, there is no any problems. So I will be assessing the motor strength of the upper and lower legs of my patient. So can you please raise your thigh with the resistance of my hands? Push it outward and pull it backward. Now to the other leg, can you please raise your thigh with the resistance of my hand and push it outward and pull it backward. Okay, that's good. We will now proceed in assessing the patient's deep tendon reflexes. So this test evaluates the brachioradialis, biceps, triceps, patellar and Achilles DTR respectively. So in this procedure, we will need a reflex hammer, but since I don't have any reflex hammer, I will just demonstrate it. So we will place our fingertips in the wrist of our client and press the reflex hammer like that. And we will repeat it to the other hand. Now we will going to place our fingers at the elbow area and our thumb at the antecubital area, over the antecubital area, and tap the reflex hammer. And we will do it on the other hands. Just like this, and this, and then you're going to tap the reflex hammer here. Next, we will be placing our fingers over the tricep tendon area and tap the reflex hammer here, over here. And we will repeat it to the other side. Just like that, and then here. Okay. Now, we will tap under the patella with a hammer, with a reflex hammer. Over here. And we will repeat it on the other side. Now we will going to tap over the Achilles tendon area with a reflex hammer. Just here, here, and repeat it on the other side, which is here. Now we will going to stroke the sole of the foot of our patient with a reflex hammer, and if we don't have a reflex hammer, we can use any other hard object like keys. But since I don't have any keys, I will just use my ball pen. So can you please lie down? Okay, the other toes. Okay, so plantar reflection with all the toes is considered a normal finding in an individual 18 months of age and older. So I will now testing the ankle flexion and dorsiflexion of my patient. So can you please push the balls of your feet with my resistance? Again? Okay. And can you please pull your feet against my resistance? Okay, good. We will now going to observe our patient walk with a regular gait on the toes, on the heels, and heel to toe. So can you please stand up? And walk with a regular gait. Okay. Kindly walk on your toes. Okay, back here. On your toes. Okay, good. And walk on your heels. Back here. And lastly, with the heel to toes. Okay, back. Okay, good. Now we will going to perform the Romberg's test. So can you please stand up? Again. Here. Close your eyes. Stand straight and both of your hands at your side. So we will count for 20 seconds. Okay, good. This test checks cerebellar functioning and evaluates balance, equilibrium, and coordination. Slight swaying is normal, but patient should be able to maintain balance. We are now going to assess our patient to a comfortable position. Now we are going to remove any additional PPE if used to prevent infection transmission and contamination of other items, and on how to perform hand hygiene to prevent the spread of microorganisms. Additional assessment should be completed to evaluate the patient's health status, and intervention by other healthcare providers may be indicated to evaluate and treat the patient health status.